This is Dr. Christopher Wood at Arizona Sports Chiropractic, and in our first video we talked about how important it is to have the ability to rotate for the sport of golf. And if you remember correctly, all rotation in the body comes from three major areas: your thoracic spine or mid-back, your hips, and your ankles. And in that video we showed you a great way of starting to mobilize your thoracic spine. Well, today we're going to talk about how to mobilize those hips. Now, when most people think of hip mobility, they think of how the hip moves on a fixed spot. And also, the direction is more of an external rotation. Now, in reality, and especially in golf, with golf, our fixed point or our stability point is our leg. And what we're doing is rotating the stable core over that hip. So we're going into more internal rotation, and now we're rotating the core over the leg as opposed to the leg over the hip. Now, this is important for a number of different reasons. If you don't have the ability to internally rotate those hips, especially on your backswing, what's going to happen is your brain's going to try to compensate and usually try to get that motion from another area, which in this case is usually going to be your lumbar spine or low back or your knee, and create more motion in those two areas that are not really supposed to move. They're supposed to be stable. And that's why we see so many lumbar or low back injuries and knee injuries in golf. So today we're going to show you an introductory progression of how to start mobilizing your hips. Okay, we have April helping us out again today. So what we're going to have her do for this is to lay on her side. Always try to use a pillow to give your head a little bit of support. You can see she's got her knees bent close to 90 degrees on this, and her shoulder is tucked under here. Now what she's going to do is bring her arm up here, and what we want her to do is push the arm and kind of get those ribs lifted up. And before we do anything, like always, we set the core. We're going to make sure the ribs are down, the core is engaged, the chin is tucked. Now we're ready to go. So what I will have you do, even though there's a number of different positions to put the leg in, I think this is the easiest with this leg straight. And we're going to have her bring her arm up here. So what I want you to do is think of this as a door on hinges. So our hinges are going to be our hip and our shoulder, and our core here and our body is going to be the door. So what April's going to do is she's going to close the door and open the door. Close as far as she can and open. So now we're getting that nice movement of a solid core over her hip, and she's keeping her core steady. She's not letting her shoulder get in front of her hip. Okay, so we're going to start with that. Now also, if you want to get the upper glutes involved, what she can do is bring her leg up in this position, keeping her hand and knee at equal distance, and she can do the same thing. She's going to close the door and open the door. The whole time keeping the knee and the elbow locked. Close the door and open the door. Now, if we want to take it a step further, what we can do is put her in what we call the low oblique sit position. So what she's going to do is come up onto her forearm, hands going to be spread out, all weight equal. You could see that she's nice and straight here. Her core is exactly the same. You don't want to see any sagging at all. So she's going to come up there, and now she's ready to go. And the leg is going to be in the same position to start with. So what she's going to do is the same thing. Close the door and open the door. Close and open. She's rotating over her shoulder and over her hip. Now again, we want to get the glute involved. We can bring the leg up here, and again she's going to bring those together. Close and open up. Close and open. Now if we want to add a little strengthening, we'll put this leg back to the original position here. And what she can tell you is that when she rotates and closes the door, she's going to be transferring the force from her hip down to her knee. So now when she closes the door, she can transfer that force, drive the knee in, and lift. And now we're getting some nice glute activity along with that internal rotation. She can come down, open the door, and now close the door, transfer the force, and drive. Keep the leg down and drive that knee in. and down. One more time. Close the door, drive the knee, and lift, and she's keeping all of this straight. So this is a great way of starting to do some strengthening as well. Now, when you become a patient at the office, you will also have access to all of our videos, our more advanced exercises that we show in this position. So like always, if you see this video and you'd like for us to evaluate you, please go to the link and contact our website, and we'd be more than happy to see you. You get a complimentary exam and consultation as an AGA member. Thanks again for watching.